progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Our life expectancy has increased due to advances in medical science. Today's healthcare challenges must be met by those who understand what the body's processes are that generate health and disease. And my guest today is Dr. Eugene Rajaratnam. He's board-certified urologist, board-certified in anti-aging and regenerative medicine, and he's a member of the medical staff at Palmdale Regional Medical Center. Dr. Raj, Leon Trotsky said, old age is the most unexpected of all things that happens to man. And when you listen to that, you hear that statement, you say, wow, it's true. As we get older, all of these things are unexpected. Tell us a little bit about what you do. What is anti-aging medicine?
Well, before we talk about anti-aging, let's talk about aging, okay? Aging is inevitable. We've been told, you got to age gracefully and all that. But what happens to most of us here is that is reduced and you actually age a lot faster these days. And the first time in history, people are not living as long as they should. You would think with all the technology in America, we live longer. Actually, our lifespan is reduced significantly. Could be from various things. It's what we call epigenetics. It's the environment, it's the toxins, it's how your lifestyle, what you eat, bad nutrition, taking too many medications and being kind of lax in your aging process. You kind of accept things. You get out of shape and you think it's okay. It's aging. You get a fat belly. That's okay. Or you start taking a bunch of medicines and you think that's part of aging and, you kind of accept it. And people are told, oh, you're pre-diabetic, and you say, oh, okay. And you think that's normal too. You got to realize that diabetes is one of those horrible diseases that significantly reduces your lifespan. It causes all kinds of complications and increases the chance of you having a stroke and heart attack by probably 100%. So when you're told that you're pre-diabetic, you have to pay attention, and doctors as a whole need to not take it as, oh, you're pre-diabetic, don't worry about it. You really have to make sure that you never get to the next step, which is diabetes. In my opinion, pre-diabetes is you're flirting with diabetes. Change your lifestyle, eat better, reduce your aging, retard your aging process. So, and a lot of things like even medications. For example, a lot of patients are on a bunch of medicines when they come to see me as a urologist. They come with kidney stones, prostate disease, whatever. But as soon as I look at them, I know that these people are on a bunch of medication. And these are very common. They have high blood pressure, so they're on diuretics, beta blockers, ACE inhibitors, and all kinds of medicines that really reduce nutrients in your body. They deplete nutrients like, let's say, for example, diuretics. That decreases magnesium, potassium, folate, B6 vitamins, B12, thiamine, and selenium. An increase in homocysteine, which is another bad thing to have. Beta blockers, that decrease what you call CoQ10. ACE inhibitors decrease zinc. And ARBs, again, blood pressure medication, decreases zinc as well. And statins, everybody seems to be on statins, almost like Kool-Aid. Everybody should be on a statin and aspirin. I don't think so, because all these medicines have side effects. What you need to do when you get a medication, ask the doctors, please tell me the side effects. These days, you don't have to go to a PDR and open this big fat book to look at it. Just Google it, and it'll tell you all the complications or side effects of medications. Statins especially, they reduce CoQ10, selenium, omega-3, fatty acids, vitamin E, vitamin A, carnitine, and free T3, which is very important thyroid medication. And you wonder why so many people have low hormones. It is induced by, number one, aging. Number two, it's aggravated by all the medicines people take. And it's undiagnosed or poorly diagnosed. And we also got to do the right kind of blood tests when you see a patient. Just doing a CBC and a KIM panel and a coag profile is, I think, very inadequate because most people, those things are normal unless you're really sick. So you got to look at things like hormone levels, and you got to do the right hormone levels. Number one, you got to check the thyroid levels like TSH, which is a thyroid stimulating hormone. And again, and free T3, which is the real hormone. A lot of people think ask, what's the thyroid hormone? They say T4. It's not. It's what we call a prohormone. So the real hormone is T3, which is a conversion of T4 to T3. And that is affected by things like not having enough selenium, iodine, chromium, stuff like that. So you miss hypothyroidism. And also the other problem, the labs have a very wide range. Let's say you do a T3, the lab will give you a reference range between 2.5 and say 4.5 or 5. So if it's 2.6, you're written off as being normal. But no, you're not. You're really on the low side of normal. Hormones need to be replenished and bumped up to high levels, and that happens a lot. I see young people, even teenagers, who are low in thyroid. Could be from toxins, could be genetic, could be familial, whatever it is. You need to pick up on it, and you have to suspect it. You have to have a high level of suspicion when you see a patient, and that could be just by observation. How do they walk? Are they, heavy? Check the weight. Check their gait. Look at the way they move. Are they slow? Do they think slow? Things like that. All those are signs of endocrine problems, meaning low thyroid, low testosterone, low estrogen, things like that. Makes you kind of tired, weak, can't sleep. All these things are significant problems that we don't think about as doctors. So we have to really understand aging, and then you go back to anti-aging. Does that make sense?
It certainly does. So let's start with diet. Where does that, as you mentioned, all of these different hormones and things that you want people to consider and look at when they're getting their blood tests instead of just the normal panel that they get, where does diet fit into this picture of aging and helping our bodies to fight some of the oxidation and free radicals?
I think nutrition is key. I tell my patients, what kind of a car do you drive? Ask them. Oh, I have a whatever car, right? Is it gas or diesel? Now, would you ever put diesel in a gas car? You wouldn't do that. That's stupid. So that's what we do with our bodies. We give it the wrong fuel daily in and out. Okay? So we're eating the wrong stuff. And unfortunately, the food industry is so mechanical now. It's all owned by big corporations. They want to produce the food quickly, harvest quickly, use pesticides, GMOs, you name it. It's so contaminated. And guess how it shows up? You get obese, you get lazy, you get toxic, and all these chemicals and toxins, they have an affinity to stay in the fat cells. So fat is not only bad for your body, it carries a lot of toxins. So you want not to get fat, and you want to burn fat. And when I see patients and they're overweight, it causes all kinds of diseases like high blood pressure, diabetes. You're more prone to having breast cancer, colon cancer, prostate cancer, all kinds of stuff. So you really have to watch what you put in your body. And food is very devoid of nutrition. There's no micronutrients in your food anymore. Even if you're eating, let's say, produce, right? The produce has to be clean. You don't know what kind of produce, where it's coming from, what kind of contamination you have. So you really have to be almost looking for growing your own food, or going to a farmer's market, and hopefully they're not lying to you, and it's really organic. See what I mean? So it's very important. Food is the fuel to your body. So you feed the wrong fuel, guess what? You're going to get all kinds of illness, diabetes, high blood pressure. There's also heavy metal toxicity out there in the air, in the water you drink. So we are totally bombarded with toxins.
Dr. Raj, wrap it up for us with your best advice about aging and the future of anti-aging medicine. What you would like listeners to know, if you had to give them just one or two things that you really want them to concentrate on to make their lives better, to make a healthier self, please give us your best advice.
Okay. There's going to be more than one or two. Okay. First is nutrition. We talked about that. Number two, check your hormones. It's not rocket science. As you get older, your hormones are going down. In women, it's obvious, menopause. But men go through andropause. So as you age, your hormones are going down. Get them checked. Fix them. Go to a doctor who understands anti-aging medicine. Even endocrinologists don't seem to get it. They're very careful in giving hormones. There's a lot of false news and all kinds of stuff that's written out there. They think hormones cause cancer. It really doesn't unless you're using synthetic hormones. So stick to bioidentical hormones. So it's nutrition, hormones, exercise, get back to your ideal weight, And it's also mind, body, spirit medicine. You got to be happy. You got to know your purpose in life. And the people who know their purpose generally are happier people. They live longer. So I see all my 90-year-old patients that I have. They're the happiest patients. They have a good lifestyle. They're out there exercising, and I put them on hormones. I'm not scared to give hormones to a 90-year-old because I think they need it. Who do you think needs it? Not an 18-year-old. It's the older people that need it. So don't be afraid of taking hormones, but go to a doctor who understands hormone replacement therapy, and hopefully it's bioidentical hormone replacement therapy.
It's great information. Thank you so much, Dr. Raj, for sharing your expertise with us today. And it's such great information for listeners to hear to help us really live our best lives. You're listening to Palmdale Regional Radio with Palmdale Regional Medical Center. For more information, please visit palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.